V.V.S Lakshman and you will be seeing me in a different role today. I am pleased to be here with Dr. Mohammed, an expert in diabetes and insulin management. Insulin, while important to many diabetes patients, is unfortunately surrounded by misconception which patients can often fall prey to, keeping them away from living the healthiest life they can with diabetes. The purpose of this initiative is to ensure that Indian diabetic patients do not get caught behind by playing an outswinger of misconception and rumors about insulin therapy. Doctor, my first question to you is, patients often feel that insulin injections are going to be painful. Is there any truth about this? How would you reassure a patient of yours who has this fear?
Thank you, Lakshman sir, for asking this question. To be honest, this is one of the most frequently asked questions by the patients in our OPDs. To answer this question with the latest advancement in technology and latest insulin injections and latest insulin injection techniques, the pain is no more. For this, mainly we need to follow two things. One is to frequently change the insulin needles and to follow the right insulin technique and to always change or to rotate the insulin injection sites.
Thank you. Doctor, my second question is, a patient may be nervous about the social stigma surrounding insulin, like taking an injection in public, or may believe that needing insulin is a personal failure of theirs. What would you tell to such a patient?
Yes, Lakshman sir. This is one of the important questions that needs to be addressed about. And this is one of the common questions also that patients ask us in the OPDs. Most people think that using insulin is a social stigma. So before initiating an insulin, it is always very important from the doctor's perspective to educate the patient about the benefits and advantages of taking an insulin and how well they respond to the insulin once we initiate to them. So once you educate the patient regarding the benefits and advantages of insulin and how well it helps them to control the blood sugar levels, so it is always an easy task from the doctor's side to convince the patient to start a patient on insulin.
Thank you. Doctor, my final question to you is, people might believe that needing insulin means they can no longer be independent, eat out, travel, or live alone. Would you say there is any truth to this?
To be honest, Lakshman sir, this is completely the opposite way what the patients and the relatives completely thinking about. When the patient is on insulin, what they think is like they cannot eat the food they want to eat. They cannot travel with the insulin happily. Advancement in latest technology in developing latest type of insulins, it is always convenient to take the insulin appropriately according to the food what you are taking. It is very helpful in terms of flexible dosing also. The patient who is taking insulin, when they are trying to travel, they can keep their insulin to maintain the potency in insulin packs and cooling boxes. So it is a myth that patients who is on insulin cannot eat the food they love to eat and cannot travel with the insulin. So in this way, the patient can maintain their healthy life even when they are on insulin.
Thank you for your time and your input, Dr. Mohammed. I'm sure your insights and expertise on insulin therapy will be of tremendous benefit for the millions of diabetic patients living in India. When you're batting with insulin, it's important to avoid the outswinger of misconceptions for a better inning.